Bill had already mentioned, my name is Chris Klein. This is my wife Jennifer, and you know, we've been very interested in all that's been happening and going on and changing in our life, in our community, in our own family, associated with this virus and all the responses. And I think like a lot of people, we're concerned, and we've become a little leery, to say it kindly. It just doesn't seem to add up a whole lot for us anymore, in all honesty. When it first started to happen, I can remember sitting with my wife and reading the news and listening to the experts telling us about what was coming, and we were very concerned, okay? And, we went from me being at work every day to me being at home working for weeks to me being furloughed. And I was furloughed for my job 14 weeks. I actually had to change jobs to get back to work because it was just on, and I was 4 weeks and then 8 weeks and then 12 weeks. And I had no real direction from my boss or my company what was going to happen. So ultimately I changed jobs, and now I'm back and I'm working again, but I'm again working from home. And that's okay. It's not that big a deal, and I have a job, and I'm grateful for that. But with our family, we again up front we're like, okay, we'll do what we have to do. If it means some sacrifice, we're okay with sacrifice. We know we're called to sacrifice, right? And we're not interested in harming people in any way. We're not interested in spreading a disease that is going to kill people. Obviously, no. But as we watched the movement of what was happening, what was going on, and we didn't see it affecting anybody we knew, we just started to really wonder what's actually going on here, and became leery, and my wife in particular spent a ton of time researching, reading, watching video, and just trying to understand like what is going on here. And for me personally, I think about 4 to 6 weeks into the shutdowns and everything, I started to be very keenly aware of a narrative that was being fed so completely across mainstream media, through politicians, through so-called experts, and I started to see, honestly, like CIA, PSYOP, psychological warfare put in action on a large-scale level across these outlets. I think when it really kind of hit me over the head as I was flipping through channels one night, and up on it was a commercial, and it was flashing images of phrases, just flash, and then blank, and then flash, and then blank. And that is 101 PSYOP training from the CIA. And so I'm going, what is going on? What? And the other big thing I think that really struck me was when everybody who seemed to go against this common narrative started getting shut down. Not just shut down, but shamed, ostracized, losing licenses. And I saw it with my own two eyes. My wife was seeing it with her own two eyes. These social media platforms just erasing people that were contrary to that common narrative. And that was another thing that just struck me like, okay, what is going on here? Why aren't people able to voice an opinion that is opposite of this narrative? And that again was those two things put together really got my radar up about what are we dealing with here. And I still ask myself almost every day, and I pray every day for wisdom from God as to what is going on here. Where are we going? Where is this leading to? What is the end game? I don't know. I have a really hard time believing that it's all about health and safety anymore. I don't see it. And so, what we're going to really focus on today is, since we are in the state of Ohio, we're going to look at the advisory system, for example. We're going to look at what goes into that. I mean, most of all the data that we have in here is right straight from the state of Ohio website, where you can go yourself and get the information. So it's not like we're pulling, conspiracy theories out of left field here. We're just trying to explain, what we're seeing and try to get a little perspective as to what it actually means. So again, I'm going to start with this slide here, which is from the Ohio Public Health Advisory System. And I'm sure most of you are familiar with this, if not all. But basically, it's a map of the state. It's broken down by county. And the counties are assessed a emergency level based on certain criteria. And we'll go through that criteria. You can actually see there's 7 criteria to the right of the map. And I'll pull that up so we can actually read it. But that's how we're constantly assessed. Our counties are assessed as to the threat level or emergency level of this virus and its spread. Okay, I'm not a virologist. I'm not an epidemiologist. I'm not a doctor or nurse on the front lines of this. I have a Bachelor of Science in Mechanical Engineering. I've worked my whole life in technical fields and for companies that design and supply systems in various industries. But I am a real staunch proponent of critical thinking and allowing each of us to come up with our own interpretation of the facts and what's going on. And it doesn't seem like that's really being promoted as being the right thing to do anymore. And I feel it is. I still feel it is. I want the government to inform me and my family as to what's going on, and I want us to be able to make our decisions on our own as to how we're going to deal with the health and welfare of our family. So, again, this is just kind of an overview of what we're seeing right now. What it means is there things, I do feel like the information has been presented in a manner that makes it appear to be a lot more threatening than it actually is. I think that's one of the ways. I'm not going to say that we've been thrown misinformation or lies from the government, but I think that it's being spun in such a way to make it look maybe a lot worse than it actually is. And again, don't know the end game there, don't know why exactly, but I hope to at least shed some light on what we're seeing here. So, okay, so this is the advisory system. Again, it looks at the counties. It assesses a threat level for each county. And the one thing you will notice on this map, there's one color that in my mind is missing. Would anybody else say there's maybe a color missing on here? I know she is. And I'll just say, there is no green. Okay, there is no green. It's kind of all
cautionary red, orange.
All emergency, all scary, all the time. I mean, and I heard in one of the governor's weekly meetings where the press conference, and I believe it wasn't the health director, not Amy Acton, but the one who stepped in after her, who said, there is no green. And there will be no green until there's a vaccine. And that hit me hard. I'm like, wait a minute, you're telling me that if we have no deaths, no ICU patients, that there's no green in any county? How does that make sense? I mean, I don't understand. So again, another thing that was one of those aha moments for me where I said, this doesn't make sense. Okay, so there's the basic overview. I'm going to start going through and come back to this CDC. Here's the website of the state of Ohio. What they say is the Public Health Advisory Alert System is a color-coded system designed to supplement existing statewide orders through a data-driven framework to assess the degree of the virus spread and to engage and empower individuals, businesses, communities, local governments, and others in the response and actions. That makes all the sense in the world to me. When I read that, that sounds great. That's what I want, to be honest. Okay? All right, next slide down. So here's the current threat levels. I hope you see that. Yeah, that looks good. So level one, again, there's no green, so the lowest level is yellow. And there are 7 different parameters that are used to assess the threat level of any given county at any given time, okay? If you have 0 to 1 of those indicated parameters, if you've exceeded what they consider to be, and we'll go over that, acceptable, then you're in yellow. If you have 2 to 3 of those indicators, you go to orange. 4 to 5 is red, 6 to 7 is purple. Now, this information is to be used by the local health departments, school officials, whatnot, to determine what they're going to do, what sort of mandates they might place on people in the public, in the school systems and whatnot, to, with the desire to keep people safe and to slow down the spread, okay? Okay, that again, all that in itself makes good sense to me. Now, we're gonna go over the indicators. So indicator 1 is new cases per capita, and if you exceed 50 cases per 100,000 people over a 2-week period, then the indicator is triggered, okay? And again, yeah, and these are Summit County only, yeah, okay. The data that's being shown here is for Summit County, okay, it's not, but the indicators are the same for all the counties in Ohio. Okay, so 50 cases per 100,000 people. Okay, so let's just leave that as it is for now. Indicator 2 is the sustained new case growth. If the data shows at least a 5-day period of sustained new case increases, the indicator is triggered. Okay, so a 5-day period. Okay, so if we're saying that the number of new cases goes like this, and is increasing over 5 days, and again, that makes sense to me. Okay. Indicator 3, proportions of cases that are non-congregate cases. So the congregate case, the one you've heard about mostly are prisons and elder care facilities where people are basically living in that facility, they're not leaving that facility, and they're with each other. So again, 50% of new cases come outside of those. Again, the common sense in me says that makes sense, okay? Indicator 4 is sustained increase in emergency room visits, okay? So again, a 5-day period, a 5-day increase in the number of people who have visited an emergency department with COVID-19 related symptoms. That's important to note. Or COVID diagnosis in any time over the last 3 weeks, this indicator is triggered. Now, again, the logic associated with this indicator, to me, it makes sense. I think the COVID-19 related symptoms is really important to note, and we'll talk about that a little bit more. Oops, I skipped one. Indicator 5 is sustained increase in outpatient visits when there is an increase in the number of people in outpatient settings, including telehealth appointments with suspected or confirmed COVID-19 symptoms. Again, suspected is an important word. Over a 5-day period and in the last 3 weeks, the indicator is triggered. Okay, so again, you've got 5 days where there's an increasing number of cases being indicated, triggers this one to be a positive. Indicator 6 is sustained increase in new COVID-19 hospital admissions. So again, an increasing trend of at least 5 consecutive days in the number of new hospitalizations due to COVID over the last 3 weeks. This will result in this indicator being triggered. So again, it seems logical to me. I see the intent of what we're looking at here. And then finally, the last indicator is indicator 7. This is ICU bed occupancy. So if the ICU occupancy goes above 80%, that's 80% overall for the hospital, and at least 20% of the occupants are COVID patients, over three, do you know what that is, Sonny? It says 3, what, in the last week, this indicator is triggered.
Over 3, the bar, essentially.
Okay, so 3 days.
Yeah.
Okay. So again, all this seems to add up to a reasonable way to assess how are we progressing with this virus. For me, one of the big issues is what they use as probable cases and how that plays into all this. And I'm going to go back to that slide. Okay, for a minute. Yeah. So important to note is the CDC explained the case definition. And this is a clinical criteria. Again, this is a criteria that would be used to count somebody positive from a probable standpoint. So if you have at least two of the following symptoms: fever, measured or subjective, chills, rigors. What is rigors?
Would it be like shivering or, I don't know.
Okay, I don't know. Myalgia, headache, sore throat, new olfactory and taste disorders. Okay, so you have at least two of those symptoms. Now, when you read those symptoms, they sure sound a lot like the common cold or common flu, right? I mean, absolutely. I mean, okay. Well, at least one of the following symptoms: cough, shortness of breath, or difficulty breathing. Or severe respiratory illness with at least one of the following: clinical or radiographic evidence of pneumonia or acute respiratory distress syndrome, and no alternative, more likely diagnosis. Okay, so this is the CDC expanded case definition, and the problem, and this is the main problem for me of the whole advisory system, is again, there are so many other things that could lump you as positive under here that it just doesn't seem like we can ever get away from this. I mean, we're heading towards flu and cold season. We're basically there. So how are we ever going to be anything but orange or red or even worse, purple? And that is where it all falls apart for me, right there. So, again, I'm not going to share my testimony. I'll just give you a highlight of it. I walked this earth for 4 years without faith. I was raised in the Catholic Church, and I know who Jesus was. I knew a lot about the Bible. I knew the Bible stories, but I didn't know Christ personally. And it wasn't until Easter Sunday of my 40th year that I accepted Christ. And I've walked mostly in sanctification since. I've still got a long way to go, but I do believe that truth is extremely important, and the truth of the gospel, obviously, number one, but even truth in other matters. I mean, the 9th commandment tells us not to bear false witness. And I think there's a lot of that going on in our country right now. And we just like to understand it a little better and come to our own conclusion about how we should act and hopefully be allowed to do so by the government. For me, as a Christian, I think my greatest and probably one of my most challenging calls is the call to share the truth in love. I think it's really easy to share the truth, and it's really easy to show love, but sharing the truth in love is not always that easy. And I do think it is our greatest calling. So my wife and I try to, remind each other that as we deal with this and deal with just visceral attacks from outside parties that don't want to hear at least what we believe is sharing the truth. And it's quite a culture we live in, and it seems like our civil liberties are just being eviscerated day after day. And I mean, it's certainly I believe what's made this country what it is today. You have to allow people the freedom of speech, even if you don't agree with them, even if maybe they're wrong. I still feel that's what's made this country what it is today. And we have to find a way to try to push that narrative, I think, into our society. So that's my part. I'm going to leave it to the real expert, my wife here, to finish. Thank you.
All right, I have a big mouth. I don't even know if I need the microphone. Let me start off by saying, who has been to the actual Ohio websites and looked at numbers and kind of played around there? Has anybody? Okay. So we're gonna look at that. My side of it is just going to be all the numbers, the deaths, the cases, the hospitalizations. I'm going to encourage, if you have any questions, please ask while I'm talking, because I wanna make sure that you guys are understanding what I'm saying when you walk out of here. I'm going to put, Sherry's gonna put this on the video, she's recording it right now. I will put every single link that I talk about. I'm not an expert. I don't tell everybody I'm an expert. I'm just a mom that got really, really upset when I saw my kids starting to be used as a pawn. And so I said, what is going on? This isn't, their lives are being disrupted. They're not allowed to play games. They're not allowed to go outside. They have to wear masks. Why? And so, I have gotten really involved, to the point where I'm part of a lawsuit that we actually have taken to federal courts against DeWine to stop all of the mandates. It was filed a couple weeks ago. So I have contacted probably over 3/4 of all of the county health departments, spoke with them, gotten death certificates. So the stuff that I'm showing you is stuff from Ohio's website, but it's the way they present it that keeps you wondering what is really going on. So I'm gonna show you how to download it and look at the information yourself. I'm gonna show you how to sort it. And we're gonna start off with, and I'm gonna do this real quick so you guys can read this a little bit better. So, is anybody familiar with an ICD code in the medical field? I worked for quite a few years in the medical field. An ICD code is a code when someone passes away or you get sick, it's how insurance is paid. So when you go into the hospital and you have a broken foot, there's an ICD code for that. They type it in, the insurance now knows, okay, I have to pay on this. When COVID came around, an ICD code was created, U07.1. And what that means, it's a confirmed case. It has gone through testing, it has been through a laboratory, and you have a positive. Not to say it's not a false positive, but it's a positive. So a U07.1 is how you know it's confirmed versus probable. I'm not gonna be able to say that today. So what happened a couple weeks ago is the CDC came out and actually said, and I don't know if anybody heard this, the 6% of the deaths from COVID were only from COVID. 6%, which took it to, I think, about this, now this is countrywide, it took it to about 10,000 deaths. 6% of those deaths happened just because of COVID. The other 94 were from complications with COVID. So not necessarily the death was from it, but say they had a brain aneurysm. And I actually have seen some of these death certificates that had stuff like this. They had a brain aneurysm. They tested them post-mortem and they came back positive with COVID. They're now a COVID death. So those 94% of deaths, while it is sad and tragic, there was a passing. Not every one of those 94% should have been marked COVID. So, and then I have the website that gives that information. And like I said, I'll give you guys every single website in the comments, because I want you guys, the best thing that we can do for ourselves right now is learn and become more knowledgeable and not just sit and listen to mainstream media. And the governor's got his own agenda, and we have to be careful because the way he presents it, sometimes it's difficult. And I'll show you what I'm talking about with that. So there's a certain website when I was looking for the death certificates, and a lot of them, after they started realizing kind of what we were looking for, they would send us to their legal team instead of giving us, which death certificates, I don't know if you know this, are public records. They're supposed to give them to us. They stopped after they started realizing, hey, why are these two women contacting all the health departments? What's going on here? But a couple of them gave me this website, and it's called the Information Warehouse. And on here, I can run reports that are just from that ICD code, the U07.1, and I'll show you what some of those numbers look like, because when you look at the number of Summit County by their numbers and by the confirmed cases, it's a very different thing. When you look at it from the state numbers versus the confirmed numbers, it's about 1,000 less, just in deaths. So, and that's just from confirmed cases. It's not, you can't distinguish then between with and from. So, has anybody been to Summit County's dashboard? Did you know Summit County had a dashboard for COVID? No? All right, so Summit County, and once again, this is the website. I'm trying to be as transparent as possible because I think that's the only way that we can stay truthful. So I will put this one also on the comment page. So this is the front of the Summit County. And they keep it, it's very cluttered. It's very hard to look at. There's 3 slides actually to this. But if you look at the very top, it says COVID deaths 19, and it's 264, 5% death rate. You go over to the next one, it says death residing in LTC, long-term care, 177, 31% death rate. This is where it starts to get a little, why are you doing it like this? The cumulative confirmed and probable cases, like Chris said, probable, why are we putting probable? Why are we not just sticking with confirmed? So the confirmed cases for Summit County is 4,882, okay? So they're essentially taking the 264 deaths divided by the cases, and there's your death rate. We all know that there's asymptomatic out there. There's a lot of people not getting tested. That death rate looks scary, 5%, we should all be staying home. It's you know, lock down, keep your kids, why are our kids even going to school? You can't, we'll never probably know the true death rate. CDC did a report a couple months ago, and I didn't put it on here, but I will find it if anybody's interested, that there were 4 scenarios, and the highest death rate was 0.7% across the state of Ohio, or actually across the nation. So when you look at this, you go, okay, 264 people have passed away in Summit County, 5% death rate of Summit County. But what you don't understand is it's not 264 people and then 177 in long-term. That's one number. So in Summit County, 69 people in general population have passed away. It's not, those 2 numbers are added together. So 177 in long-term, and it's a shame because, you know, the people that need to be protected the most right now are the elderly. So when I run a report by the ICD-9 code, remember we went to, there was 246 in Summit County that had passed, right? When I run it by a confirmed positive test, there's actually only 187 in Summit County that have passed away. And then if you look, and I don't know if you can see it very well, 74 were between the ages of 75 and 84. And then 55 of them were 85 and older. So out of that 187, what's the math, Chris?
Looks like about 130.
So about 50 actually in general public passed away in Summit County since the beginning of this, by the way. This isn't just like last month. About 50 passed away. So that's just where, if you're not involved in looking at these numbers, the numbers are a lot scarier. Does anybody have any questions about Summit County or go?
So when you look at that number and you break it down that way, how does it compare to other things like, you know, the flu?
Heart disease is still actually the #1 killer in Summit County.
Right.
The flu has disappeared this year. Like I mean, I know it really has though, because
Afraid of the COVID.
I can run this report. I can run everything from suicides to, I mean, you can run any ICD-9 code you want. The flu doesn't really exist after March because they all became probable. because of like Chris said, right, so it's a very low number, very low number.
So I'm gathering, it says 35 to 44, there was only 3 deaths.
3 deaths.
Okay, so then where did my neighbor come up with these 2 children dying in Summit County?
There were 2 children in Summit County.
Yeah.
No.
Yeah, I mean,
There have been 2 children at the age of 19 that have passed away in Ohio, or the state of Ohio, but unfortunately, they had a lot of physical problems. I don't know but they were already in hospice, both of them. So,
so if the flu got them, they would have been the same thing?
right.
Okay.
Yeah.
And just,
I understand that if you are tested, let's say in April, and you have the coronavirus, and so they count you as one person.
Yes,
But then in May, if you're tested again and you have it, that doesn't come back to one person, that's 2 people.
Yes.
Is that what they do?
Yeah.
yes. Yes.
Yeah.
So for some people to go to work, you have to have a negative test. So say on Friday you test positive and you're feeling better Saturday, so you get tested, you're still positive. You go back on Monday because you're feeling better, you test positive. Finally on Wednesday, you get a negative. Those 3 positive tests are actually 3 cases and not clumped into one person.
And part of the reason for that is because of the HIPAA laws. The case can't be associated to a person. It cannot. So it's just a case, it's another
Right.
case. One person could have 10 cases against their name, but because of HIPAA laws, that can't be associated with an individual person. So therefore, it's just another case. It's broken down by age range, it's broken down by gender, it's broken down by county, but not by person.
And then another part of it too is, so you've probably been hearing about, I just got a letter that said I was positive for COVID, I never got tested. That has actually been confirmed. What has been happening is like they go to these pop-up tests and you write your name down, or I don't even know if it's a pop-up test, but CBCA, or not CBCA, CVS or Walgreens or whatever, you go in for a test, you write your name down, you say, forget it, I don't wanna wait anymore. Well, they don't cross your name out, they just keep going. So now, here's a line of, 20 people and number 10 left. Well, number 11 now becomes 10. And that all those people underneath shift up for their testing. So, and we actually, like, through this lawsuit, have got confirmation that that's happened quite a bit throughout Ohio, so.
How many, because I say the same thing about the flu and the pneumonia, how many people have actually been confirmed to have pneumonia this year?
You know what, because I don't want to answer a question if I don't know. I told Bill if there's any question I can't answer, but I can run the report as soon as it's over.
Okay, because that's what I'm hearing, is there's no flu, there's no pneumonia this year, but everybody's got COVID.
Right. So, and I can even show you how to run the report, and we can do it afterwards, because I think I would agree that things.
Pneumonia would be easy to erase too.
Well, and pneumonia is a side effect of COVID.
So it'd be easy to erase that.
Exactly.
Well, and on the death certificates that I have seen, pneumonia is one of the causes of death behind COVID.
But-
Or is it the
but
other way
thing is
around?
too- But the thing is too, a lot of people do get flu shots,
Mhm.
very seldom do people get pneumonia shots.
Right,
The doctors don't recommend it unless they have an underlying condition.
right.
You know?
Right. And that's the big thing with that 94% that have passed from COVID. They had 2 to 3 other conditions. So they had heart disease, they had hypertension, they had diabetes, they had obesity. Like, it wasn't just that they were healthy people.
Right.
These 96.4% that passed away had confirmed 2 to 3 other comorbidities. I said it right.
Legally, you don't have to wear a mask. The stores will say
No,
you can't.
it's not a law.
It's not a law, but stores will say you can't enter without a mask, blah,
Right.
blah, blah. But if you have an underlying condition and you can't wear a mask because you can't breathe or.
Right.
Can they throw you out of the store or?
I got thrown out the other day from Menards.
Did you? My husband and I, we had to wear a mask, we didn't have one, we wore our motorcycle helmets.
Yeah, I walked around for an hour talking to associates and everything else. I was in the checkout line and they said, you need to leave unless you put a mask on.
I got yelled at a giant eagle for going the wrong way down one. By a lady
I sometimes
pushing
do that on
the car.
purpose.
By a lady pushing the car. The employee was leading me that way to find something.
Well,
And this
Walmart
lady
has
was
taken
coming
those
through and she's
signs
like
down.
under her breath yelling.
They-
Yeah, Walmart will make.
Yeah, they
They'll
took the
just say-
one-way signs
They
down.
let
I
you,
mean-
they'll alter and they'll say.
All right, so does anybody have any questions about, no, go ahead.
How many people actually died last year compared to this year, do you know? in the
Um,
same period? Cause I tried looking that up when it first started, and they took it down as quick as.
I haven't run the numbers in a couple weeks, but we are not far off of the actual death rates for the last 2 or 3 years, the average for the year.
From the flus and.
Mhm.
and that's, I wanna build on that a little bit, cause that's a good point, because if you look at the death trends year over year, and if
We're not.
that per capita number is staying pretty much the same,
Exactly.
you're going, wait a minute.
Right.
Are we just shifting from one cause to another, you know?
The flu.
You know, speaking on that, like, I gave you guys that David Collin,
Yeah.
Computer Forever. The death toll in Ireland, compared to last year, they've actually had less deaths this year.
Right,
That's a
Right.
fact.
yeah. There's actually been less children's deaths this year. And they think it might, I won't start that.
Yeah.
I understand that the Spanish flu that was so bad that killed so many people, 20% died from the flu, 80% was bacterial pneumonia.
Yeah, yeah. I mean, there's a reason behind all of this, and God knows, God's got the plan, you know, but that doesn't mean that we shouldn't be fighting for the truth and knowing exactly what's, you know, going on.
Not saying this, but you kind of get the idea that they might be trying to work toward a forced vaccination.
Yes,
Mhm.
That's what the whole agenda is here.
I-
Later on down the road, that they'll take stuff away from you if you don't get vaccinated.
which is why we are fighting so hard about the masks.
Yeah, that's what.
Because it's a placeholder, is a lot of people feel that way. And that's why we're fighting with that lawsuit, is to get our rights back, you know, that,
Trying to get people's minds going toward that
you've never quarantined healthy people,
and get us thinking that
And
way.
everywhere you
And why
go,
is
they're
OK
gonna
skipping
give you
ball?
a mask.
right? All right, so on the state level, who's been to the state website? All right, good job. So the state dashboard, is a very interesting, website. It took a lot of months of fighting. There was a particular reporter, his name is Jack Windsor. Great guy.
I like him.
Yeah, he's good. And he asked some tough questions to Governor DeWine. But he wanted transparency. So when Governor DeWine gets up at his pressers and talks, he does a reported death count. I think at the Thursday death count, he said, or the Thursday press conference, he said 87 deaths. Did anybody hear that?
Yes.
There were 3. So 87 is reported.
Right.
3 is actual. And what happens is, so there's a time lag on deaths, obviously. You know, it's not like they pass away, boom, it's in the system, hey, this is what the number is. So that 87, the 84 go back from September 15th all the way to January. And it just could be paperwork, somebody, you know, a piece of paper, a death certificate got stuck under a book or whatever. It's always growing and moving. But when he stands up there and says, there were 87 deaths reported, you take it as what? 87 deaths passed, 87 people passed away yesterday. That number is actually 3. And one of the biggest things I think we can do is to learn how to find that number. I think it is one of the most important things because it's just knowledge, it's educating yourself, and it then in turn allows you to educate other people on how to do this. And we can actually find these numbers ourselves. So if you go to the coronaohio.gov page, there's further down called a dashboard. And on the dashboard is, like the screenshot I just showed you, it's the state of Ohio with all of the different counties. You can click on these guys and it'll show you actuals if it wants to. Like for the day. It gives you daily count. Now, this used to be completely cumulative. They wouldn't show you the daily count, so it just looked like every day we were getting worse and worse and worse. And if you weren't understanding how to play around on this page, it did look like, okay, we are in a pandemic. We need to be worried. We should be staying home. The kids shouldn't be going to school. So right up here, there is a download the summary data. And if you click on that guy, I haven't done this, so hopefully it'll go through good. We're gonna open it, and it's gonna open into Excel. And what this does is this is every line item from that website. It's gonna give you your hospitalization, it's gonna give you the county, the age, the date they got sick, the date of their death, the date of their hospitalization, death due to illness. Now this is an interesting one because when this first came out, they were marking every single death as from the virus. There was a big group that finally said, hey, you're lying, this isn't working, come on guys, you gotta be truthful with us. And we actually, if you see, started putting zeros in that line item. So sometimes they might have died, but it's not counted as an illness count now. And that happened probably, I wanna say about mid-June. Now they didn't go back and fix them, but that's okay, because at least they're starting to show some transparencies. So I'm going to filter this by date of death, and we're gonna go newest to oldest. And there's these lines have been here for these unknowns. I'm not sure how these poor people don't know what day they died, but they have been there from as long as I can remember. There's 18 of them. They don't have a death date. They know their age, they know everything else, but they don't know when they actually passed away. So we're gonna hide those guys for just a minute. So on September 18th, we had 1 death. Now, please understand, this number will change because it is growing, and like the 87 deaths that we had the other day, 84 of them were backlog. So that number changes. That 3 has become a bigger number now because paperwork's been coming in and stuff. The problem is 87 is still a lot different than, let's see, what do we got, 5. So when he did that press conference and said 87, we're now up to 5 deaths for that day. Go ahead.
So each one of those line items represent a person.
Yes.
Okay?
Yes.
Okay, so when I was looking at this, I mean, what are they counting? The case count, you see that case count number over there above the G column?
This guy?
Okay, yeah. So that you see that total, but if you scroll down there, some of these people, I saw one guy who was tested 339 times.
That was a data dump for the prisons.
Oh, okay. And the
They
ones
clumped
that-
it into one name.
There's like 58 or something.
Wow.
Yeah. So if you notice sometimes, and I don't know if we'll see anything, but I think it was in April, they did the big prison testing.
Yeah.
And that was one big data dump of like, I think there's one that's even a couple, like 1,000 or something.
Yeah.
And it's
So,
into one
did-
name.
Did the Ohio State thing have the same impact when they tested Ohio State University?
Ohio State, so there was just a report done. So there's been, for the 5 top universities in America, in the United States, there's been 11,000 some positive cases, not one hospitalization or death
Right.
in the colleges. So, but yeah, those numbers would be affected in this too. So, you know, it's just a download for the file, getting on Excel. I play with this file a lot, just trying to keep up and see what the numbers are. If you see here then, where I'm highlighting, you'll see that some of them are zeros and some of them are ones. If it's a 0, they didn't die from COVID, but they had COVID. So they're finally reporting that with a little bit more transparency behind it. So the total death count for Ohio as it stands right now is 4,612. But if I do my ICD report, I'm trying to find there it is. If I do it from the ICD report, that's just the confirmed cases, it's actually 3,574. So that's just, that's confirmed COVID positive tests, but I can't take that difference in and say, okay, but how many of them actually were from COVID versus with COVID? So that's something that we're hoping will become even more transparent with the lawsuit, that these kinds of things they have to start showing.
Is that number though, the seven,
Yeah.
whatever number, is that just a number that's almost like used for medical billing? Like if somebody goes in with a broken ankle, they use this code?
Yes,
And so most of them, it's just that they use that code for billing, they don't even exist.
CDC, or the CDC or who, I can't remember who created the ICD code. But there's two ICD codes. There's U071, and that is a confirmed positive test. And then there's U072, and that's probable. But you can't run, they don't even put those in this certain report because
You can't even find it.
you can't even find it. So they do have two codes for an actual confirmed
In a lot
and
of
probable.
cases, like, if something's not necessarily covered on your insurance,
Right.
a lot of times the doctor will use that code because they're gonna get paid and
Well, and the other big part of this is there is being payment.
$12,000
Yes.
for every death.
Right, 12,000 and 34,000 if you, or 33.
13 and, it's 13 for a positive case of COVID, 39,000 if they were put on a ventilator.
If they were put on a ventilator.
So that's what the hospital gets from the government.
In my doctor's office, I was at my doctor's last week or the week before, and he was telling me that he had a patient, she was on dialysis, she had kidney problems, she had liver problems, she was in a facility, she was
Right.
older, and she died, and they got like $12,000 for her death. And she
Right.
didn't die from COVID, and he knew it.
And that's the same with nursing homes.
Right.
I guess if you die, it's 700, but by golly, if you die with COVID,
Right.
they give you 1,700.
Right, so it's, there's too much incentive for this virus,
Yep.
and that's part of the problem. Was it Idaho that just opened up?
Pennsylvania,
No, the one that opened on their own.
Idaho, yeah.
Idaho just opened, and the governor came forward and said, with us opening, we're losing about 134 million in federal funding. Because the longer you stay closed with an emergency, the more federal funds you get. And Idaho decided to say, I'm done, I want my country, my state open, and so he came forth and said, we're losing about 134 million in federal funds because of it. But I want my state open.
Well, with the kind of money they're getting,
Right.
doesn't.
So, but so, the biggest thing is we have to be careful with the numbers. When you hear the numbers spoken about how many deaths died that day, go run the report and see for yourself.
That's why,
How can they do that if they actually know that there's only 3 people? How can they announce that?
Well, and that's a big thing that Jack Windsor, this investigator reporter was part of, is he just wanted transparency. Come up and stand there and say, hey, we had 87 reported deaths yesterday, but out of those 87, 3 of them were actual.
Yeah.
And that's all it took.
Tell
And-
us the truth.
Right, and that's where there's a lot of us fighting and frustrated because it's scary. You hear 87, that's still an active virus. It's moving, but you hear 3,
I mean, I think, and again, this is what I saw, is it's more about smoke and mirrors than anything. It's,
right?
and they say reported cases, it's not like they don't say reported cases, but to the average person who's not really paying attention, that just means that's how many people died
That's
that
how
day.
you report it.
But it's not, and that was like the cumulative bar. When I first saw that was driving me crazy because, like, if you have no cases today, your bar is still this big, and every day it's at least that big, and it can only get bigger. So you look at that graph across, it looks scarier.
Right.
But in fact, if you look at the trend, it goes like this and it looks good.
Right.
And it's like, why aren't they showing us that?
It's all about money.
Yeah, it is the root of all evil, isn't it?
Isn't this actually what they call the coronavirus?
Say that again?
This is actually what this illness or whatever this, thing is.
Yeah,
The coronavirus.
Right.
COVID-19 is actually the government response to it. COVID Action 19. I mean, that's right out of PSYOP's book.
There's a lot.
If you ever trained in PSYOPs,
no comment.
it's exactly how to train in the
There's a lot of people that call it the Chinese Communist virus.
All right, so
Back to task.
in all the craziness of this, I have been very blessed to start working with a lot of people, and I've been kind of the background, putting the numbers together for them, and then they've been creating graphs and stuff. There's a really good gentleman, strong Christian, his name is Dr. Frank on Facebook. Does anybody follow him? I highly recommend. He's a modeler. He's been modeling these pandemics for 30 plus years, and he has always he was part of the AIDS pandemic and showing how the model was going to look correctly. But he's been modeling the COVID, and his models are so much closer to the truth than what we were given at the beginning of this, where we were going to have 10,000 cases a day and 5,000 deaths and stuff. But Dr. Frank models. He's very strong. But I've been helping with some of these the numbers and stuff. And so this is a graph showing the deaths of COVID versus actual versus reported. So if you see some of these high spikes up here, so remember I said at the last press conference on Thursday, he said 87. So that dotted orange was what was reported. The dotted orange lines is what was reported, and then the blue line is what was actual that day. So you can see the disparity between the lines. And if you guys want to come up and look at them too, I'll keep this open so you guys can check it out. I know it's hard to see the orange.
So what you're saying there, that's 87 deaths that day.
Reported
Reported.
deaths. But if you look way down at the blue graph, it's 3.
Right, that's confirmed.
Yes.
But those deaths could be anything. It could be a heart attack or.
Right, that's the problem. We still don't know if they died from or with. And that's the big
No, those are
confirmed cases.
confirmed
Yeah.
COVID.
So
confirmed
like you saying, the guy,
corona cases.
he should be saying, we've got 3 confirmed deaths
Right,
for the day.
right.
And
And
instead
then
of like-
84 backlog.
Yeah, and I mean, and again, the reported case is all about, it's reported on this date. It didn't necessarily happen on this date,
Right.
but it's being reported
okay.
on this date. That's the
which
difference.
test did they use for this? The first Governor DeWine test or the second Governor DeWine? For billing purposes, did they use the first one?
I think they use both. All right, and then, so, when this all started, what was the big words? Flatten the curve, get our hospitals ready. This is showing kind of our hospital usage and IC bed usage. So the blue is reported cases for the day, cases, not deaths. The orange, the top line, is the ICD-9 or the ICU beds, and then the yellow is just total hospital beds. As you can see, we never got close to needing to flatten the curve. Our highest level of using a regular hospital bed was 4% of the beds used. 4.6 actually. And then our highest level of using the ICU beds was 10% of the beds used. And that was at the beginning. So we flattened the curve pretty well. If you notice that term is not really used anymore. Now it's all about cases. So, and then this is just kind of the total cases is the top line. The recovered cases total is the green line. The active cases that are going on right now is the yellow line, and then total deaths is the red line, the bottom line. So that red line is steadily staying low. We have done a nice job of lowering the death count. Our active cases, actually, we are usually in the negative of cases that are confirmed versus recovery cases. we're in the negative because we're having more recovery happening now every day versus cases that are positive. So that's great. And then the last one is kind of just showing different big events. So the first day of school opening, all the lines are still going down, and that was about 4 weeks ago. July 4th, they went up a little bit, but so did testing. We started having a lot of pop-up testing all over the state, but so the blue is hospitalization, the gray is ICU, the yellow is ventilator, and then the red is the actual deaths for that day. So as you can see there, you know, the case numbers did go up, but the hospitalization and the deaths didn't follow those cases. You would see that there would be a bigger jump where that big blue spike is. There should have been a big, about 2 weeks later, should have been a big blue spike or gray spike and yellow spike. So while the case numbers are going up, hospitalization and death are still going down, which is great. So, and then the last one is just kind of age group, you know, how many deaths per age group and how many cases. Now, interestingly enough, most of our positive cases, the blue line, are all college level, but they've had 13 deaths. Through this is from the beginning of this. There's been less testing done in the elderly, but they do have the highest level of rate of death. So, which is a shame. They should be getting tested more, I think.
Here's a thought. You're seeing that spike in the younger age.
Mm-hmm.
Okay. For the most part, like when people get old, you know, the flu's out there and everybody starts taking precaution and all that. I wonder if somehow you could maybe do a parallel of that, let's say the flu of the age groups and all that, and see
Right.
where you have the more of the younger people because they intermingle more, you know, and you know, you see what I'm
Run
saying?
a parallel
Because
between the two.
Yeah.
Yeah, that'd be
Just-
interesting.
There's a lot of ways.
Yeah.
You know, even like elderly people.
Right. So
And the more elderly people are going to die of the flu. I
Exactly.
hate to say it, but
actually, interestingly enough, more younger people die from the flu than
Yeah.
COVID.
oh, they do.
Not that there's there's still more elderly people that die, but more children have died from the flu
Yeah. Okay.
than they've passed from COVID.
Yeah, I think one of the things we did run across, and I think it was the 2017-18 flu
Yeah, it was
season.
bad. It was a bad year.
There was like in the range of 600 children that died from flu
In Ohio.
in Ohio. 600.
Did you remember wearing a mask?
No,
We've had two, and again, those two cases in
My kids went
Ohio
to school.
for COVID, they had significant other issues, comorbidities.
Yeah.
I mean, this has been way, it's not even in the same realm of flu from that 2017-18 flu season for kids.
So does anybody have any other questions? I hope I answered all of them. I hope I opened a little bit more understanding of the numbers and, you know, and I do. I hope that, you know, the next press conference that you guys go and look at the numbers yourself, because it does bring down calm and the anxiety down.
But there's like people that deny this.
Yeah.
They buy into all this, and they'll go to the grave.
They will, and that's all right. That's
You
their
know,
right.
David Koresh would be proud of him. You know, that he's got a new cult, the Branch Covidians.
Well,
You know?
and they can turn around and say the same. Here and there, you're not gonna. There's a lot of people that have a lot of fear, and
Yeah.
that's where we have to show them grace and love, and try not to get angry and nasty like they want to get angry and nasty to us. So
Yeah,
I got a neighbor that's locked in her house, and she's gained like I don't know how many pounds, and
the COVID
come out and we're talking, and she shoved me, and like you go get away, and it's like I said, you're a hypocrite because you just touched me. So then what's
Well,
you know,
And I think
Wait.
oh, sorry.
Go ahead.
Go ahead.
Have a question.
Sorry. What can we do to help you and your team in, you know, getting these facts out and, you know, controlling this better? Because the government is controlling it, and
you know, the biggest thing is making sure when you're sharing news about COVID that it is the truth. I think that we all start getting excited and we see a funny meme or we see something that, you know, we're just gonna share, and then we find out later it's maybe not completely truthful. But I think that's all we can do is just keep sharing the truth.
And
The
I think-
facts.
And again, I
You can't
think,
refute what we've put.
Mhm.
We're not lying about it, we're not making up the numbers, you know, it's their website, and that's what I like to point out. I didn't create an Ohio website, and now I'm gonna make up the numbers and show them to you. I'm showing you the numbers that the wine has his staff put in. So I think the biggest thing is just keep coming at them with truth that, guys, it's not that bad,
So,
I think it's just another.
I just wanna,
right?
I wanna make sure I understand this. So when you said like that 87 mark and it was like only the 3, now that's not a cumulative, that's just reported for that day,
Correct.
the deaths
Right.
in the state of Ohio.
Right.
So it could go, like, there could be no deaths the following day.
Right.
And it could be like this. So,
Actually, Summit County hasn't had a death since September 11th.
of a human being, like, in general, of anybody.
Well, no, of COVID.
Oh, okay.
Summit County hasn't had a death in over a week.
But those, what they're saying, okay, the 3 confirmed, or 2 or whatever it was, 3, and the other 84 were maybe suspected?
No, the other 84 were from the day after,
backlog.
yesterday, and then all the way to January. It's just backlog paperwork.
They're just saying
so
it's
let me try to
87
explain it. The
reported.
87 is a recorded death number, but it's not recorded for that date
Right.
necessarily.
It's recorded.
It could be recorded from last week, last month, 2 months ago, and for some reason, they're only getting the information today.
Right.
So they're reporting those deaths today
So
because,
that's a cumulative
Yes.
from, since January 1st.
yes.
Right.
So when they
Yes.
started, this
Right.
bats stew flu and all that.
Interestingly enough, when we started kind of downloading this, there actually is a death in 2019, and then they took it away.
They took it away.
It's gone.
It was on the site, it's no longer.
Yeah.
Wouldn't it be interesting to know?
We have screenshots and.
Wouldn't it be interesting to know who's guiding the wine?
Yeah.
To explain it
Yes.
the way he is.
Yeah.
Well, it's not money.
He's just a puppet too,
Yeah.
Right.
but who's telling him
I'll make this meeting.
to mislead us that way? I'd
That's a
like to
great
know.
question. That's a great question.
That's beyond my
I wanna
expertise.
know.
That's
All right, Bill.
always, and I wanna, hey, Bill,
Just
the facts, let's
Hey,
just stick.
but I do
Right,
wanna,
that's it.
I wanna finish, cause I wanna answer your question a little more personally. What can we do? And here's what I've decided I can do, okay? When I walk into a place, I don't wear a mask. If somebody gives me a hard time, I have a discussion with them. And I say, listen, here is why I don't wear a mask, okay? I'm gonna explain it to you, okay? And ultimately, I will say to them, if you are uncomfortable for whatever reason, you feel afraid of the virus, you feel afraid because it's your job to tell me to wear a mask, I will put a mask on for you. But I'm not gonna wear a mask because I'm afraid. And I believe my wearing a mask spreads fear among other people, and that's why I don't wear it.
You know, my big thing is,
That's a
because I
good
have
little thing,
allergies really,
spreading
really
fear
bad, so
on
when
the
I
mask.
wear a
Put
mask,
that
I
on.
can't breathe and
The
my
masks
nose is
don't
running.
work.
Or
And then
Right.
it makes
The
it seem
masks
like
do
I do
not
have
work.
the virus.
At
Symbolic
my-
compliance.
At my doctor's office, they don't wear masks. The doctors and the nurses don't wear masks, and they have a letter
Right.
that you're not breathing fresh air, you're just rebreathing your air, which is not
Right,
good.
right. Chuck,
Wearing a mask all day long, I heard that people breathing back in.
the
Yeah,
CO2.
that's just what I say.
Dioxide, I guess it is.
Yeah.
People are having lung problems.
Yeah,
Is that true?
yeah.
Yeah,
It's worse for my allergies.
yeah, it is.
It's not really
And then I
healthy.
said- and
I
then
will
the
say,
store,
if you guys
that's
wanna-
fine, and I'm
So one of the
constantly
things with the lawsuit,
and I think I have it.
it's ohiostandsup.org. It has 600 pages of evidence that has been confirmed evidence from mask wearing to different things. So if you on your own wanna do some research, there are some confirmed
Got a
stuff.
few days to read.
So, but there's 600 pages of evidence that our
Ohio
lawyer,
stands up.
ohiostandsup.org.
Where we go, our doctors, they don't wear masks.
Yeah,
That's what I just said, my doctor didn't either, because you're
right,
breathing in.
These people, they
come up with
40
okay, yeah,
We're good here,
we're good.
because it's over an hour.